had my initial mastectomy, I had saline implants. And because of radiation, radiated skin, they call it the gift that keeps on giving, because for the rest of your life, the tissue will constantly, gently, subtly seize up and tighten. And through years of this tightening against the saline implant, it was creating a tremendous amount of pain in this whole area. And I had wanted to have the surgery revised with different implants. And the plastic surgeon at Sloan Kettering had said, listen, because of radiated skin, your chance of infection goes from 2% to 10%. And if you get infected at any point during the surgery, they will take out the implants. You'll never be able to have implants again. The implant failed, and I needed to have it redone. And I knew at that point I had done enough research where I knew that as much as I love Sloan Kettering for cancer issues, when it came to reconstruction, I knew that there were other options that might be available to me that they might not be able to offer to me because of their protocols. So I asked my nurse practitioner at Sloan Kettering for a referral for someone outside of Sloan, but someone who was obviously well-versed in dealing with cancer patients who only did breast. I did not want a plastic surgeon who did other body parts as well. I wanted somebody who just did breast. The first name and only name she came up with was Connie Chen. The thought of not having any foreign substance in my body at all, of it being my own tissue, of not having the pain, of not having to deal down the road with another redoing of my implants when these possibly would fail, because, breast implants, to my understanding, are not a lifetime thing. They do wear out. So all of it just was amazing to me, blew my mind. It was an extraordinary experience. Dr. Chen was very thorough in her description of what to expect. And again, I asked a million questions. It was a very intense recovery because you're recovering from the abdomen where the tissue was harvested from. Mm-hmm. You're recovering from the actual surgery site. Plus, we did she took out, I had a little implant done on the girl on the left side, so she would smile the same. In fact, that was actually the implant that failed. When the implant failed, I thought I had breast cancer again because I was feeling all these lumps. And when I went for the mammogram, thank goodness it was not breast cancer, it was just that the implant had failed. So they removed that. So there were several procedures done at once. So it was quite an intense recovery. But once we recovered, it was great. I felt like a new woman. Since then, I have been on sort of my own personal mission, which is a twofold mission. The first thing is I try to let people know all the time about this procedure, about the deep flap surgery, women especially. I'm very open about the surgery, the fact that I had the breast cancer and my experience, and especially, in today's world, you're always running into someone who either has their own personal experience with cancer or is mother, sister, friend, and I will always say, please check out this procedure before they do anything. Please have them look into this procedure and see that this is an option. It might not be the option they choose, but it is an option. And because it's so many people are just not aware that this option exists still. And then my second part of the mission is to tell them about Dr. Chen. I think she is so wonderful, and I think anybody would be very lucky to have Dr. Chen and her staff behind them.